Wouldn't it be nice if caregivers were given some basic hearing aid training with great respect and appreciation for our amazing caregivers worldwide? The video version of this basic hearing aid training for caregivers is a public service provided by Each Ear, LLC. A printed facility reference guide is also available on hearingaidtraining.com. Our first instructor is Dr. Antonio Calderon. Dr. Tony is a medical doctor, a board-certified hearing instrument specialist, and an industry trainer. He has served as Treasurer for the Executive Committee International Hearing Society, Governor for the Southwest Territory International Hearing Society, Regional Training Manager, Amplifon Corporate, Regional Manager and Trainer for Miracle Ear Corporate, Professional Development Director, Avada Audiology and Hearing Aid Care, and presently is an independent training consultant for hearing aid professionals. For years, Dr. Tony has had his finger on the pulse of the hearing healthcare profession. This is yours truly, Ted Venema. I earned a PhD in audiology from the University of Oklahoma. I have been a clinical audiologist serving the public in 2 locations at 2 completely separate times in my career. I've worked at a hearing aid manufacturer where I learned hearing aids inside and out. I've also been a professor of audiology at 2 different universities. And I've developed and implemented a 2-year hearing aid specialist program at Conestoga College in Kitchener, Ontario, Canada. I am also the author of a textbook on hearing aids, now in its 3rd edition, and I greatly appreciate being one of your instructors today. And our 3rd instructor is Jeff Samanda. Jeff is president and founder of Each Ear LLC, the innovative company, providing this training video as a public service. Jeff has amassed more than 30 years of experience in entrepreneurial development and ergonomic design. He's been issued 6 patents that utilize ergonomic design as either inventor or co-inventor. Jeff received the first place award in the state of Wisconsin's Governor's New Product Award competition and a prestigious technical design award from Johns Hopkins University. His work has been featured in 3 University of Wisconsin annual reports, in 3 Hearing Review articles, in Time magazine, and on the front page of the Wall Street Journal. Jeff has been fitting hearing aids as a licensed hearing instrument specialist since 2010. He's also developed Educational Discussion Events, a community outreach program covering 6 relatable hearing loss topics. We welcome you to our training course, developed especially for caregivers. We hope you enjoy it and know that you find it useful as you provide excellent care. To recognize your participation in this course, you will be issued a certificate of completion for you to proudly display. We will be covering consistent hearing aid wearing, the various styles of hearing aids, powering hearing aids on and off, safeguarding hearing aids and loss prevention, cleaning and maintenance, insertion, putting the hearing aids on, when to reach out to a medical professional or a hearing aid professional, and resources for caregivers. Jeff, please start us off.
Thank you, Ted. Let's start with consistent wearing. What is consistent wearing? Consistent wearing means wearing most or all of the time, with a few exceptions. We'll list these exceptions for you in a minute. The benefits of consistent wearing. Consistent wearing can improve alertness, social interaction, fall prevention, and overall safety. Here's an interesting perspective. The brain protects us by exaggerating everything that's new, like a watchdog barks at a stranger. What we want is for the brain to be at one with the amplification, so that it's normal. If we don't have consistent wearing, it's harder for the brain to know what is normal, and it's always trying to adjust and figure out what is normal. So generally, we want the resident to wear their hearing aids all of the time, except when they are sleeping, showering, or bathing, exposed to loud, continuous noise, getting a haircut, and using hairspray so that we're not spraying on the microphone ports. or if they are experiencing pain or irritation from wearing their hearing aids. The various styles of hearing aids. There are 3 basic styles of hearing aids. First is the in-the-ear style, or ITE. Second is the behind-the-ear style, or BTE. This BTE style has either standard tubing or thin tubing. Then the third style, and by far the most popular style, is the receiver in canal, or RIC. You might find this on a quiz. The RIC style hearing aid is by far the most popular style hearing aid. Here are a couple of notes that apply to all hearing aids. Right and left are indicated by color markers. The red marker indicates the right hearing aid, and the blue marker indicates the left. Just remember, R for red, R is for right. And for all practical purposes, the terms receiver and speaker refer to the same thing. So throughout this video, for the sake of simplicity, we'll use speaker when referring to the receiver. Now let's review the components of these various hearing aids. Starting with the in-the-ear, ITEs come in various sizes, and each size has its own distinctive name. For our purposes, we'll just refer to all sizes as ITEs. The ITEs typically have the following components. Microphone ports. Some ITEs have a program button and/or a volume button. Here it's a program button. A battery door. Let's talk about batteries for a second. Generally, hearing aid batteries are available in 4 sizes. Sizes 10, 312, 13, and 675. When installing a new battery, remove the tab from the battery and let the battery sit in the air for about 3 to 5 minutes before installing it. This allows air to reach the materials inside the battery and activate them for optimal performance. ITEs use either size 10, size 312, or size 13. Okay, back to the components. Here is a volume wheel. When in the ear, top to the front is louder, and top to the back is softer. Here is the vent. It's an air duct through the ITE. Generally, the amplifier is a sophisticated sound processor. It is encased in the ITE. Here's another view of the ITE. Again, here's the battery door. This one has a button set up for volume control instead of a volume wheel. This button can be set up as a volume button or a program button or both. Generally, pressing the button on the right hearing aid increases loudness in both hearing aids, and pressing the button on the left hearing aid decreases loudness in both hearing aids. Here we see the speaker that goes into the ear canal, and the wax filter protecting the speaker. We'll talk about wax filters in a bit. Now this is an optional removal filament. These are used to remove the ITE from the ear. BTE. BTEs typically have the following components. The microphones are located here. The resident will want to hold the phone, the telephone, a little higher so that the phone speaker is positioned over the BTE's microphones. Some BTEs have program buttons. If needed, BTEs can be programmed for different listening environments by the hearing aid professional. On BTEs, the volume control may be a button as well. Typically, pressing the button on the right hearing aid increases loudness in both hearing aids, and pressing the button on the left hearing aid decreases loudness in both hearing aids. In this case, we are illustrating a toggle switch that controls the volume. Pressing the toggle upward increases loudness in both hearing aids, and pressing it downward decreases the loudness in both hearing aids. The amplifier in the BTE is in the casing. The battery door is located here. BTEs will use either size 312, 13, or 675. The more powerful size 675 battery is used in larger, more powerful models that require a higher energy supply. Ear hooks screw onto the hearing aid case. They hold the hearing aid on the ear and provide a connection between the output of the hearing aid speaker and standard tubing that further directs sound into the ear canal. Here is the standard tubing. This tubing should be flexible. Finally, this is an ear mold. Ear molds come in a variety of sizes and styles, and they may or may not have a vent hole. Now, here we have a thin tube BTE. The speaker is still in the amplifier casing, and it still has tubing, but the tube is thinner than standard tubing. In most cases, at the end of the tube, you'll find a dome that is inserted into the ear canal. And now RICs. RICs evolved from BTE thin tubes. The main difference is that with the RIC, the speaker is not in the amplifier casing, it's in the ear canal, closer to the eardrum. This is a huge improvement in both the delivery of processed amplification and versatility. There is so much more that can be done with a RIC hearing aid in terms of making needed adjustments over time for the user. And for these reasons, RIC hearing aids make up over a whopping 72% of the U.S. hearing aid market. RICs typically have the following components. The microphones are here. Again, the resident will want to hold the telephone a little higher so that the phone's speaker is positioned over the RIC's microphones. On RICs, the volume button may also serve as a program control. If it's set up as a volume button, typically pressing the button on the right hearing aid increases loudness in both hearing aids, and pressing the button on the left decreases the loudness in both. The amplifier in a RIC is in the casing. This is a rechargeable RIC. If it had a battery door, it would be located here and use battery sizes 10, 312, or 13. This is the cable. It is thinner than a thin tube, and it is not a tube. It is an insulated wire that delivers sound process amplification to the speaker. Here is the speaker. This speaker or receiver is placed in the ear canal, thus the receiver in canal style. Attached to the speaker is a dome. This is typical, but sometimes the speaker is encased in a mold, and we'll see this later. Now, under the dome, inside the end of the speaker is a wax filter. Again, we'll talk about wax filters in a bit. Next, powering hearing aids on and off. Different styles can power on and off in various ways. The ITEs power on by closing the battery door and power off by opening the battery door. BTEs generally also power on by closing the battery door and power off by opening the battery door. Today, RICs are sometimes rechargeable. If they are rechargeable, generally they power off automatically by simply placing them in the charging station. Then they power on automatically by removing them from the power station. If they don't turn on automatically, you may have to hold the button down until it flashes, generally after 3 seconds. And if they are not rechargeable, then they too will power on by closing the battery door and power off by opening the battery door.
Safeguarding hearing aids and loss prevention. To safeguard your residents' hearing aids, store them in a safe, dry place, preferably a central location designated just for hearing aids. Use a chart, such as each year's residence hearing aid chart, to document the whereabouts and cleaning of each residence hearing aids. This chart can be found in the resources pages of hearingaidtraining.com. Cleaning and maintenance. Hearing aids are specialized and sophisticated little sound processing computers, and they operate inside of ear canals where they're exposed to earwax and moisture. Regular cleaning and maintenance will give your residents years of reliable, better hearing. Cleaning your residents' hearing aids every day will help reduce moisture and wax, reduce the number of repairs needed, and will help keep the hearing aids sound quality high. In this section, we'll start with the tools needed to clean hearing aids. Then, when to clean your residents' hearing aids, and finally, how to clean each of the 3 basic styles of hearing aids. Tools for cleaning hearing aids. Each resident must have their own set of tools to avoid contamination. You want to get yourself organized with these tools. To remove moisture and debris from hearing aids, a soft, dry microfiber cloth is preferred, but you can also use tissues, and disinfectant wipes can be used, but only if they are made for you to use with hearing aids. Never use water, alcohol, or chemical wipes to clean a hearing aid. Pick and a brush is used to remove earwax and debris. We will be covering this. Replacement wax filters to keep the amplification clear. Picture a mini coffee filter with holes on the bottom. The amplification comes up through the hole, and the cup of the filter catches the earwax and protects the speaker below it. Typically, each hearing aid manufacturers have their own specific wax filters, and some manufacturers have various models, each with their own filter. We want to be sure that we have the correct wax filter for the resident's particular hearing aid. Vent holes. In ITEs and molds, improve the quality of amplification by venting some of the low frequencies. A vent cleaner is used to remove earwax from these vents. A thin tube cleaner or plastic cleaning wire, shown in green, is used to clear wax out of the inside of the thin tube. A drying jar or drying beaker removes moisture from the hearing aid overnight. A bulb blower is used to force water and moisture out of the standard tubing of a BTE style hearing aid. And finally, this specially formulated cleaner is used to clean, disinfect, and deodorize ITE hearing instruments and ear molds. Access to these tools can be found in the resource page of hearingaidtraining.com. Again, each resident must have their own set of tools to avoid contamination. This chart, the tool chart, will help you organize the appropriate tools for each style of hearing aid. You can download this chart from the resources pages of hearingaidtraining.com. When to clear your residents' hearing aids. Again, the residents' hearing aid chart found in the resources page of the hearingaidtraining.com helps track the cleaning of each resident's hearing aids. Of course, you always wash your hands well before cleaning hearing aids, and the morning is the best time to clean the hearing aid. This is because it has had time to dry overnight, making wax and debris easier to remove. So each morning, use the pick and brush to remove any earwax and then wipe it clean with a cloth. And at the end of the day, wipe the hearing aid down with the cloth and then leave the battery door open overnight. This helps air out the device, let moisture escape, and extend the life of batteries. Then store in a drying jar. Ted, I will turn it over to you now.
Thank you, Dr. Tony. Here are the steps for cleaning ITEs. We'll start with daily cleaning. Gently brush the microphone ports and vent openings to clear away wax buildup or debris. The components you are cleaning should face downward so any loose particles fall out of the hearing aid. Then, use the pick to clear anything out of the holes that didn't come out with the brush. Next, check the wax filter. Let's talk the wax filter. It's this little white thing. Picture a coffee filter with holes in the bottom of it. The amplification comes through the holes from the speaker below, and the cup of it catches earwax and protects the speaker below it. It keeps the speaker clean and like new. But when earwax gets in it, it can cover these holes and block the amplification, resulting in weak or distorted sound. If enough gets in there, and it doesn't take much, it will act like a cork and block the amplification altogether. So, look into the wax filter and make sure it is clean. Replace the wax filter if you see any earwax at all inside the wax filter. If it's clean, there's no need to replace it. To replace the wax filter, insert the empty end of the replacement unit, usually it's a stick like this, into the current wax filter. It will click in. Go ahead and pull it out. Then rotate the stick and insert the new wax filter into the sleeve and pull the stick out again. The stick with the old wax filter goes in the garbage. Be sure to use the same replacement wax filter that was originally supplied with the hearing aid. Hearing aid professionals can tell you about the specific wax protection system in your resident's hearing aids. For larger vents, run a vent cleaner carefully through the opening in each direction. For smaller vents, run the thin tube cleaner carefully through the opening, again in each direction. Finally and gently wipe the device with a clean dry cloth or tissue to remove debris. Once per week, gently brush the battery compartment to remove any wax or debris. Here are the steps for cleaning BTEs. Starting with daily cleaning, gently brush the microphone ports to clear away debris. The components you are cleaning should face downward so any loose particles fall out of the hearing aid. Use the pick and brush to clear out any earwax buildup in the ear mold openings that didn't come out with the brush. Gently wipe the amplifier with a clean, dry cloth or tissue to remove debris. On a daily basis, clean and disinfect and deodorize the molds by wiping them with a specially formulated cleaner. Once per week, gently brush the battery compartment clean, as well as the microphone cover, to remove any wax or debris. Now turning to the molds. For molds with larger vents, run a vent cleaner carefully through the opening in each direction. For the smaller vents, run the thin tube cleaner carefully through the opening in each direction. Remove the ear mold from the hook to clean it. Some ear molds, especially those made from soft materials, can become discolored and stain over time. Soaking them in warm soapy water will help. Ear mold cleaner will help as well, but do not use alcohol or other chemicals on them. Allow the molds to dry completely overnight before use. The ear molds may develop a slight odor over time, but a strong odor could indicate you have an ear infection, so reach out to your medical professional if you notice it. Use the bulb blower to force water out of the tubing and then allow it to dry completely overnight. Some BTEs have thin tubes. The thin tubes need to be cleaned in order to remove earwax that makes its way up into the tube. Remove the tube and run the thin tube cleaner carefully through the opening in each direction. The tubes, both standard size and thin tubes, should be replaced with new tubing at least every 6 months because they will get hard and brittle over time. I think this is on the quiz. The tubing can get hard and brittle and should be replaced every 6 months. Replacing the tubing is a job for the hearing aid professional. Here are the steps for cleaning RICs, RICs. Let's start with the domes. Use your thumbs in a tissue to gently massage the dome tip to push out any stubborn material. Replace the dome as needed when it becomes worn or if there is a buildup that can't be removed. To remove the dome, I recommend using a tissue. Get underneath it and peel the dome off from the side. When you are ready to reattach it, it clicks on straight down. Be sure to use the exact replacement dome that the hearing aid professional selected for your resident's hearing aid. Ask him or her for help if you're not sure, because it's critical that the dome match the prescribed amplification and the physical fit. You want to remove the dome. Look into the wax filter and make sure it is clean. Replace the wax filter if you see any earwax at all inside the wax filter. If it's clean, there's no need to replace it. Wax filter replacement is just like on ITEs. You will insert the empty end of the replacement unit, usually it's a stick like this, into the current wax filter. It will click in. Go ahead and pull it out. Then rotate the stick and insert the new wax filter into the speaker and pull the stick out again. The stick with the old wax filter goes in the garbage. And again, use the same replacement wax filter that was originally supplied with the hearing aid. If you are in any doubt about these wax filters, again, contact your hearing aid professional. Gently brush the microphone ports to clear away any wax buildup or debris. The opening you are cleaning should face downward, so any loose particles fall out of the hearing aid. Gently wipe the amplifier with a clean, dry cloth or tissue to remove debris. Once per week, gently brush the battery compartment clean, as well as the microphone cover to remove any wax or debris. If the RIC has a mold with a larger vent, run a vent cleaner carefully through the opening in each direction. If it has a smaller vent, run the thin tube cleaner carefully through the opening in each direction. Once per week, clean, disinfect, and deodorize the molds by wiping them using a specially formulated cleaner. Jeff, I'm turning it over to you.
Thanks, Ted. Insertion. Putting the hearing aids on. To start this hearing aid insertion section, we begin by reviewing the anatomy of the outer ear, ear canal, and eardrum. Looking more closely at the outer ear and ear canal. In the outer ear, we want to note the area known as the concha. This is the bowl-shaped cavity just outside of the opening of the ear canal. In anatomical drawings and hearing aid owners' manuals, ear canals are generally depicted as rather straight, but this is likely not accurate for most of your residents, for most anybody for that matter. We will be referring back to the anatomy and cover ear canals in greater detail in a moment. ITEs are almost always custom made by taking impressions of the outer ear and part of the ear canal, so it should fit like a glove when positioned properly in the ear canal and concha. BTE molds, whether attached to a standard tube or a thin tube, are custom made by taking impressions and should also fit like a glove when positioned properly into the ear canal and concha. Here are the steps for inserting ITEs into your residents' ears. Hold the ITE by the top and bottom as shown, or by the removal filament so that the wax filter is facing inward and the removal filament is at the bottom, and gently place the ITE into the ear canal and concha. Again, it should fit like a glove when positioned properly in the ear canal and concha. Here are the steps for inserting BTEs into your residents' ears. To insert BTEs with standard tubing, hold the mold by the bottom so that the tube is facing out or toward you, and the vent hole is at the bottom. Twist slightly to the right or clockwise and gently pull back and up on the ear, and then gently push back and rotate the mold backwards or counterclockwise, placing the mold into the concha. With your finger, make sure the entire mold is tucked into the concha. Then hang the amplifier on the ear. Most thin tubes, however, have domes attached to the end instead of a mold. If the thin tube has a dome attached to the end, first hang the amplifier on the ear, and then take the 90-degree bend in the tube with 2 fingers, your pinchers, and wiggle the tube end with the dome into the canal, typically as far as it goes, as long as it's comfortable for your resident. Here are the steps for inserting RICs into your resident's ears. RICs will have either its speaker with the dome or its speaker in a mold, but in most cases the speaker will have a dome on the end of it. But let's start with the speaker in the mold. Our suggestion is to start by inserting the mold into the ear canal and concha. Hold the mold by the top and bottom or by the removal filament, if it has one, so that the wax filter is facing inward and the removal filament is at the bottom, and gently insert the mold into the ear canal and concha. This mold is likely custom made, and again, it will fit like a glove. Then, as shown in step 3, hang the amplifier on the ear. Okay, now let's cover how to place the RIC hearing aid on your resident's ear when it has the speaker with the dome. I recommend starting by hanging the amplifier on the ear. Then take the 90-degree bend in the cable with your 2 fingers, I call them your pinchers, and start the speaker into the canal. Wiggle it gently while using your pinchers. Then move the tail into the concha bowl or concha valley. And finally, with your fingernail facing forward, push on the back of the speaker as you gently wiggle it into the canal, as deeply as possible, as long as it's comfortable for your resident.
Let me interject here, Jeff. The advantage of the RIC having a speaker with a dome is this. Generally, we have the potential to achieve sufficiently deep insertion into the ear canal. Sufficiently deep insertion helps ensure your residents will receive their prescribed amplification for optimal hearing and understanding. The potential for that high-pitched feedback is reduced. They're hearing aids that are more secure and less likely to be lost. They stay in the ears better, and the hearing aids are even less noticeable. But most importantly, your resident is receiving his prescribed amplification for optimal hearing and understanding. But there are some challenges to achieving sufficiently deep insertion of the RIC speakers.
Thanks for bringing that up, Ted. It's an important point, and that's why RIC hearing aids are by far the most popular style of hearing aid. But there are challenges for achieving sufficiently deep insertion. For caregivers, it is much more difficult than it has to be to control and maneuver the speaker as you wiggle it into the ear canal. Your fingertip often just slides off and past it, especially when your residents' ear canals are angled and have bends. Remember, the hearing aid user's guides generally depict ear canals as nice and straight, but again, this is just not accurate for most of your residents. Ear canals are often angled, include bends, and they can be obstructed by cartilage. This makes it harder for you to have any kind of control over the speaker as you attempt to wiggle it into their ear canals deeply enough. The ear canal's initial angle is the direction of the initial entrance into the canal, accommodating approximately the first half of the speaker. The first bend is the subsequent direction of the ear canal that the speaker is required to follow to enable sufficiently deep insertion. Knowing both the initial angle and first bend of your residents' canals will help you aim the speakers as you wiggle them into their ear canals. Now, if you struggle to insert the RIC receiver into your resident's ear canal, you can print off a free copy of the Each Ear Canal Identification Guide from the hearingaidtraining.com resources page. Give it to your medical professional or hearing aid professional and ask them to indicate the initial angle and first bend for you. Here's some very good news we want you to know. That there is an internationally patented improvement to these RIC speakers that will make it much easier for you to insert these speakers into your residents' ear canals. In just a minute, we'll talk about this groove button technology. First, some high praise for the hearing aid manufacturers. Over the years, young hearing aid engineers have developed utterly amazing technology in the areas of sound processing, speech and noise management, directional microphones, rechargeability, and Bluetooth connectivity. These enhancements took and take an incredible amount of effort, skill, time, and support. They have our appreciation and our respect. But when it comes to insertion of the speaker, these engineers are missing the mark. You see, they themselves are young, and their engineering job has nothing to do with caregiving. So how could they possibly be able to empathize with caregivers who are tasked with inserting RIC receivers into another person's ear canals? This is apparent when we see them depicting ear canals as straight and simple in their hearing aid owners' manuals.
But with this new groove button technology, caregivers will gain better access to and control over your residents' RIC speakers because they are ergonomically designed with a fingertip support, a fingertip backstop, and a fingernail groove. See how the fingertip and fingernail fit in the groove button, making it so much easier to control, maneuver, and steer the speakers so that you can gently wiggle them in sufficiently deep into even the most challenging of ear canals. Use of high-end prototypes have proven the obvious efficacy of groove button technology. They work exactly as expected. And hearing aid professionals have also endorsed groove button technology.
So, we're now petitioning to make RIC hearing aid insertion easier for everyone. The petition reads, "Respectfully, I urge our Veterans Administration to stipulate groove button technology in all hearing aid purchase orders." If you agree groove button technology will make it easier for caregivers like you to insert your residents' hearing aid speakers, please give us permission to add your name to the petition when you print your certificate of completion. And please share your thoughts on the comments page of thehearingaidtraining.com. Thank you. When to reach out to a medical professional or a hearing aid professional. Okay, now let's talk about reaching out to a medical professional. Here are a few situations related to the basic hearing aid training for caregivers that require the attention of a medical professional. If anywhere around the ear you see signs of redness, irritation, or active drainage, reach out to your staff nurse or other medical professional. If the resident complains of pain or dizziness, reach out to your staff nurse or other medical professional. If the hearing aid is amplifying, but the resident still can't hear, reach out to your staff nurse or other medical professional. The medical professional will check the ear canal for earwax blockages, unusual conditions, and other possible more complex causes for this. If the dome is missing from the RIC speaker or the thin tube, reach out to your staff nurse or other medical professional. The medical professional will check the ear canal to make sure the dome is not in the ear canal.
When to reach out to a hearing aid professional. It is important that your residents' hearing aids be professionally cleaned and regularly by their hearing aid professional. They have vacuums with specialized attachments that gently suck wax from hard-to-reach areas, and they know how to safely clean vents, microphone screens, speakers, and other components. Your resident's family, or you should ask their hearing aid professional for help when the resident complains of discomfort from wearing their hearing aid. If hearing insertion is too difficult for you and you need to know the initial angle and first bend of the ear canals, just ask them to indicate these on the each ear canal identification guide for you. Your resident's hearing aid migrates out of the ear all too frequently. If an ITE, BTE mold or RIC speaker fits well, but you still get feedback, or if your resident is either increasing or decreasing volume with hearing aid volume control constantly, if you have a question about the hearing aid, or if you feel your resident's hearing aids need special attention, if you need help finding a local hearing aid professional, we are developing a directory as a convenient resource for you.
Resources for caregivers. You can find the resident's hearing aid chart, the tool chart, the each ear canal identification guide, access to the printed facility reference guide, our growing directory of hearing aid professionals, and other resources available on the resources page of hearingaidtraining.com. Once you pass the quiz, remember to print and proudly display your certificate of completion. Thank you.